Clostridium difficile, often called C. diff, is a bacterium that can cause symptoms ranging from loose stool to life-threatening inflammation of the colon. The only hope we can have in this fight against such an infectious and difficult bacterium is by providing education for patients, families, and staff with the goal of interrupting the transmission of C. diff. For some people, this may still come too late, and minimizing the impact of clinical illness when C. diff is acquired requires drastic measures. For one patient, that was the case. An otherwise healthy 54-year-old woman went out to eat with her family, to the movies, and walked through the mall. All of this was a great day and a great adventure. Then 2 days later, she developed stomach pains, a fever, and began having loose stools. At this point, there was blood in the stool, which prompted her to go to the emergency department. The patient was tested for C. diff. A CT of her abdomen was done, which reflected extensive swelling and fluid in the bowel and prompted an immediate gastroenterology consult. Within 6 hours, the patient was in septic shock with toxic megacolon and required a total colectomy. No other infectious processes were identified for this patient besides having a C. diff. After 10 days of battling a septic infection from toxic megacolon from C. diff infection, this grandmother of 3 passed away. Things we do, whether we know it or not, directly impact patients. The correlation between reducing hospital-acquired infections like C. difficile and improving outcomes for our patients begins with you. It happens in hospitals across the nation, and it can happen here. We all have room to improve in hand hygiene. It is vital that we protect our patients from acquiring this devastating illness when they come to us to get better. Patient and employee safety is our top priority at Cadlick. Everything we do is centered around helping our patients and their support system. They are too important for us to be negligent in hand hygiene. C. diff is a serious deadly disease and can be acquired at any hospital across the nation. In 2012, the Centers for Disease Control and Prevention identified C. diff as an urgent threat. 2014's expected infection number is estimated to be double 2012's rate of 250,000 cases. Cadlick wants to improve our rates of C. diff infections per year, and at the center of that responsibility is the hygiene of our caregivers. C. diff is transmitted by ingestion from contaminated objects or hands. It lives in the gut, colonizes, creates toxins, and then shed through contaminated feces. It is often transmitted by unclean hands. You can stop the spread of C. diff by using proper hand hygiene and PPE. Watch for precautionary signs on the doors and follow the instructions. Wash with soap and water when entering and leaving the room. Gown and glove at the door and use proper equipment and disinfection procedures. Remember, family visitors are also required to adhere to these instructions as well. Please inform them of the proper procedures. Washing for 15 seconds thoroughly is the key to preventing the spread of C. diff. Make sure to thoroughly wash the front and back of the hands, including all fingers, fingertips, and thumbs. Clean before and after every patient contact, between clean and dirty tasks, after removing gloves, before and after eating or drinking, after coughing or sneezing, and after using the restroom. Wash for 15 seconds with warm, soapy water and use a paper towel to turn off the faucet. Remember, you are the key to keeping our patients safe and stopping the spread of infection. Thank you for all you do for our patients and our community. And remember, clean hands save lives.